All right, sounds good. Well, today I'll be presenting on helping children heal psychosocial support for grieving youth in Ukraine. My name is Dr. Meghan Sheffer, and I'm a psychologist here at Nationwide Children's Hospital, and one of my specialties is working with kids who are grieving and supporting families throughout that process. So in today's presentation, I have a few objectives that I hope we're able to accomplish together. The first is to identify models and theories of grief. The second is to explain the impact of development on a child's understanding of grief and then also their response to death so that we can identify the best ways to support them throughout different developmental stages. And then talk a little bit more about the diagnostic criteria for prolonged grief disorder, which helps us identify when grief is significantly impacting functioning and when there might be a need for more clinical interventions. And then discuss some grief-focused assessments and interventions for bereaved children and families. So to start, I want to talk a little bit about some definitions. I think sometimes some of these words get used interchangeably, and it can be a little bit confusing, but some of these words do have specific definitions that helps guide the discussion that we'll have today. So when we hear the word grief, grief is really about that internal experience. So it's the anguish, the emotional distress, and the pain that someone experiences after a significant loss. But I usually say when we think about grief, it's internally. So it's not something that we notice on people on the outside, but it's something that what we feel emotionally inside. When we talk about mourning, that's the process of feeling or expressing grief. So this is what people see on the outside, or what we call the externalizing part of how someone is coping with their grief. Bereavement is the condition of having a loved one die, so that's where we use the label that somebody is bereaved, whether that's a child or a parent. And then anticipatory grief, this is a really important one to talk about because oftentimes it's one that gets missed. We think about grief only in the context of when someone dies, but what we recognize when families and children are faced with difficult situations, sometimes they're already grieving changes to their future or grieving other losses. And so anticipatory grief is really mourning of a loss that has not yet happened. So that can be the threat to loss of ability to function independently. It may be a loss of identity or change in their identity. It might be a change in their role or definition. And this one isn't always acknowledged, so it can sometimes be a little bit more challenging for kids to cope with this type of grief. And then the last one here is disenfranchised grief, and this is grief that's not openly acknowledged, socially validated, or publicly mourned, which I feel is probably one of the most important ones when we're talking about this specific situation, because unfortunately, with what's happening in Ukraine, a lot of children and families may not have had the proper opportunity to mourn as they typically would without all of the things that were happening within the country. And what we know from children and families, when they don't have the opportunity to mourn or have that validation of their experience, that can sometimes complicate their grief experience moving forward. The other one that I don't have on here, but we might talk about throughout the presentation, is something called ambiguous loss. And that's a loss that lacks closure or clear resolution. And so this one is also relevant when we think about the war. There may be some children who do not know where their parents are, and there was no confirmation of what happened to their parents, which also tends to be a factor that can further complicate grieving because they don't have that resolution or the finality of what the situation is. So I wanted to talk a little bit about, specific to the presentation that we're having today, about different types of grief and losses that these children experience. So one, and the one that I think most of us think of, obviously, is when we think about death. A lot of these children might have had a death of a parent, a sibling, a grandparent, due to the violence, military action, or lack of access to medical care that was happening during this time. They might have also had forced separation from their parents or caregivers due to evacuation, displacement, or military deployment. And a lot of times, as we were talking about with the ambiguous loss, there can be uncertainty about the safety or whereabouts of their family and not always knowing where their loved ones are. With all of this, there was also a loss of home and community for a lot of children. So this might have been destruction or abandonment of homes, schools, playgrounds, neighborhoods, all of those places that children often would call safe places. There was a lot of displacement within Ukraine into other countries, so all of that familiarity, cultural routines, peer networks, there was a lot of disconnect happening within those because of what was going on. And also, if you think about that, that might be separation from pets or cherished belongings, right? They didn't always have proper time to be able to gather the things that are important to them. And although that's not somebody dying, these are things that are still significant to children, and it's still changes that they did not ask for that can be very difficult for them to cope with because there's a huge change in their normalcy. There was also a loss of safety and predictability for these children, right? So if you think about things like air raids, sirens, violence, nobody can predict necessarily when those happen, and a lot of times they were happening unexpectedly, so that basic assumption of safety can be threatened in those moments. There was chronic fear. They might not be sleeping as well. Some kids might have more hypervigilance, not knowing when the next event is going to happen, and they're constantly trying to adapt to ongoing threat, which can be very scary. And then because all of this, it just feels like a very chaotic environment, right? So there's loss of routine and daily structure, all of the factors that we know are extremely helpful for supporting kids' day-to-day functioning. And kids, for proper emotional regulation, they benefit from stability and routine, and that was something that was not easily provided in these situations. There's also loss of education and developmental opportunities. So when we think about kids, it's important they live in the school systems, right? Their education, those types of things are important to them. But through all of this, a lot of their education was interrupted. They might have had limited access to their teachers, their socialization, and their peer networks because they might not have been going to their typical schedule with school. And because of that, there's loss of developmental milestones, right? They had birthdays and holidays, and none of those were probably celebrated in the same way that they would before all of this started. And those are things that often mark growth and continuity for our kids, and so that's a loss that can certainly be challenging. And then the last one is a loss of trust and identity. So when we think about kids, as kids kind of go through life, they learn what is fair and what is not fair. They learn the natural order and how things work. But when they're faced with situations like this, things that are not supposed to happen, it can really be a disruption in a child's perception of the world being a fair place and adults protecting them. Because there were some times where a lot of people felt helpless in being able to protect children. They might have also felt a loss of national, cultural, or regional identity as they were navigating all of these challenges. And because of this, especially for our teenagers who tend to have more of that existential thinking, there can be a questioning of faith, meaning, and future orientation. So all that to say, I just wanted to summarize a little bit specific to our situation that grief is not just about somebody dying, but there's so many other losses that children have experienced along the way in this situation, and we want to make sure that we're taking space to validate all of those losses. A little bit of background of implications of childhood bereavement and the question of why is it important to support these kids is one that kids who are grieving, they often have an increased risk for depression, anxiety. It can be more difficult to sleep, both falling asleep and staying asleep. Depending on the situation, if it's traumatic grief, they might have an increase in traumatic stress. Oftentimes there's guilt involved. There can be, especially with our teenagers and young adults, an increased risk for substance use and then low self-esteem. Socially, to further that, they're more vulnerable to social difficulties. They have lower social competence and higher social withdrawal. And that's often, if you think about kids being exposed to this very difficult experience, sometimes it can be hard to integrate with other kids who may not have had the experience. You know, I think some of this literature is different, though, because it is going from maybe like a chronic illness in which a sibling died or a parent who died. But the situation that we're talking about here in Ukraine, lots of kids and teenagers were affected. So in that way, there may be a different implication socially, knowing that they're not alone in some of the losses that they're experiencing. We also know that grief can be linked with physical health. Most of the research is related to adults in this, but certainly we would expect it to apply to children as well. So sometimes we see things like more abdominal pain or headaches, or there's exacerbation of asthma, or there's some research to show early mortality if grief wasn't properly processed. And so we know that grief is not just an emotional experience, but it's also a physical experience for people. And then for kids specifically, we often see poor academic performance, which makes sense because it can be difficult sometimes for them to concentrate or focus or retain information. And then lastly, I think it's always important to note, again, in this situation, there's likely a lot of post-traumatic stress from what our children experience because there was a lot of trauma throughout all of these changes and loss. But we also know on the flip side, there's other concepts that we talk about and related to either post-traumatic growth or what we can also call benefit finding. And that is suggesting that when you experience an adverse event or a trauma, there are opportunities to grow or learn from things. And while I like to highlight this because I think it's important to recognize that some children and teenagers will experience this, it's also important to say that not every child will report experiencing post-traumatic growth or benefit finding, and that's okay. It doesn't mean that they're not coping well. That just might not be the way that their coping played out. And so we want to make sure that we're supporting both of those angles depending on how the child experienced these stressors. So I always like to talk a little bit about theories and models of grief to start, because when we're thinking about what assessments and interventions, it's important that we understand the theory behind them and what the application is. Most of us are probably familiar with this model. I think when we talk day to day or in society, a lot of people talk about Elizabeth Kubler-Ross's 5 stages of grief. So that's denial, anger, bargaining, depression, acceptance. And if you see from this picture how we say how we want grief to work, it's linear. How grief actually works, you can see it's all bundled up, right? And it's all mixed up almost like a tangled ball of yarn, and it moves through all different stages. And that's the most important thing when we're thinking about these 5 stages of grief. When they were initially presented, they were presented as a linear, like you would start in one stage and you would accomplish, and then you would move on to the next stage. And what we found is that grief is not linear like that. And so all of these stages are relevant, but we don't think about it as going through this very clean-cut timeline. So you might be depressed, and then you might go into denial, you might have a phase of acceptance, and all of that is normal, that you're floating through those different stages. I like to emphasize in this one, though, that most people still hear that the linear nature is what's the most adaptive coping. And so when we think about correcting misconceptions, this is one to really explain to people that it doesn't work in this linear approach. The next one is the dual process model of grief. And this is one of my favorite ones that I often use when I'm explaining to kids and families ways that I plan to help provide supports to them when they're grieving. So here in this model, you'll see there's 2 buckets. There's loss-oriented coping and there's restoration-oriented coping. When we're talking about loss-oriented coping, that's going to be your typical what you think about when grief works. So really sitting with your heavy emotions, thinking about, continuing bonds and the way that you're still connected with the person that you loved. There might be some denial, some avoidance of some of the difficult changes that are happening with the loss. That might be that expression of crying and having those big emotions. And that's what a lot of us think about when we think about typical grief work. And the other bucket is restoration-oriented coping. And this is more of that idea of, I always say you never move on from your grief, but the goal is that we help families integrate their losses and move forward. And that's really what this bucket is talking about. So it's taking these changes that they've experienced and attending to them. They might try new things that help them feel connected to the person. They may use some distraction. They might develop some new roles or identities, right? So, kids might do something that their dad really liked or go to their favorite place. And what we know about the most adaptive coping with grief, as you can see in the middle, there's these lines that are zigzagging back and forth. And what we say adaptive coping is oscillating between both of those buckets. So being able to show coping strategies in both the loss-oriented and restoration-oriented sections. If you're too much on one versus the other, sometimes we start to see maladaptive grieving. So you can see from loss-oriented, if you never have the opportunity to focus on anything restoration-oriented, you might live in more of those heavy emotions or sadness. And if you're more into the restoration-oriented, it might be more that you're doing a lot of distraction and you really haven't had the opportunity to sit with your grief, which we know tends to bubble over and cause further problems in the future. So the goal is we're always trying to find strategies that fit in both of those buckets. Multidimensional grief theory. So this is a little bit of a newer one compared to the others that I just presented. You can see here there's 3 different domains. So you have separation distress, existential identity distress, and circumstance-related distress. And what you can see in the bottom of that horizontal line is it's almost like a spectrum. So on that left-hand side, we're thinking about that type of distress. There is an adaptive or a normative way to help cope with it. And then there can also be a maladaptive way to cope with it. So for example, if you think about separation distress, which means, again, you're having distress by that person no longer physically being present, you might say an adaptive way to cope with separation distress is maybe you have a picture of your dad on your nightstand and you kiss the picture and talk to him every night before you go to bed. A maladaptive way to respond to separation distress may be a child saying, that they want to take their own life to be with their father. And so those are what when we're thinking about trying to identify those strategies, at what point does it fall on that spectrum? For existential identity distress, this is really speaking to that role and the way that kids and teenagers, see themselves after the loss. And so an adaptive way might be coping. For example, maybe if their dad was really athletic, they start to pick up a sport or something that their dad really, really enjoyed, and that's a part of their identity, like a new role or purpose that they're involving themselves in. Where on the flip side, a maladaptive strategy might be related to that of not doing anything, right? They're spending most of their time lying in bed. They're not getting up to go to school because they feel like they don't know who they are anymore, and they're having a hard time finding purpose or finding their identity after the loss. And then circumstance-related distress is related to more deaths that we would consider to be traumatic, which again, I think is more relevant to what we're talking about here. The classic example I use is like a car accident, for example. So if a family member died in a car accident, an adaptive way to cope with that might be that the child goes on to be an engineer, and like an automotive engineer, where they try to figure out ways to make cars safer. Whereas a maladaptive might be a child saying, I'm never getting in a car again. And so those are just a little bit of a difference where we're trying to think about what is adaptive versus maladaptive. And when I start talking about grief interventions, there is an intervention called multidimensional grief therapy, and it's going to use these domains to really guide the supports that we're talking about. And then we have continuing bonds. So continuing bonds is, this connection. So way back when, prior to this theory coming out, people always thought it was odd when people talked about wanting to still feel attachment or bonded to the person that they loved. And after a lot of research by Klaas, Silverman, and Nickman, what they realized is that is actually a really adaptive way for people to grieve when they have a significant loss. And we're going to talk a little bit about how we can facilitate continuing bonds in the intervention section. But the goal really is to think about, even though that person is not physically present, how can you still feel connected with them? And that can look in a lot of different ways. And you can see on the picture, similar to what I was talking about before, it's a picture of the person that they loved who is no longer here, and talking to them, right, and maintaining that connection. Okay, now we're going to move a little bit more into developmental considerations, but before we do that, I want to talk a little bit about the 4 basic concepts of death, because that's going to talk a little bit about when we're thinking about children's understanding and the ways that you support them. It'll help make that a little bit more clear as we go through each stage. So there's 4 basic concepts about death. One is that death is irreversible. All life functions end completely at the time of death. Everything that is alive eventually dies, so we call that the universality. And there are physical reasons that someone dies. So just keep those in mind, and as we go through the developmental stages, we'll talk about, as kids go through these, what concepts they understand and which ones do they not quite yet understand based on their developmental stage. So we're going to start with infants, so 2 years and younger. So with infants, we know that from a developmental perspective, they're egocentric, meaning they live in their world, right? They don't have a lot of concepts of understanding of what's going on around them. They're preconceptual, so it's very difficult to help them grasp specific concepts, much less something as difficult as death. And they're very present-oriented, so they recognize what's going on in the here and now, but thinking about things that are happening in an hour, a day, a month, all of that is too far for them to really quite understand. So when we think about what death means to infants, what they are going to recognize is abandonment, right? And that's really when we think about that caregiving perspective. So for example, for any of our infants whose parents may have died, or any of their caregivers, or even a sibling who provided some type of caregiving, that is the loss that they're going to recognize, that person isn't, putting their diapers on, feeding them, holding them, soothing them. That's going to be that main loss that they pick up on. Obviously, again, because they're so young, their ability to grasp those 4 concepts I just talked about are something that they're not able to do. So, for those who are talking up on that upper level of 2, they would still feel like death is reversible. So maybe it's something you're sleeping and then you're waking up, and they also do not understand its permanency, right? So they don't think it's something that is permanent and that it's a lifetime change. What we see for infants in common grief reactions, so we tend to see more crying. We'll see a little bit more of that emotional lability, and it can be more difficult to console infants in these cases. And a lot of that goes back to because their routines and their caregiving styles are being changed by these losses. We might see some more developmental regression. So if they had gotten to a stage where they're not sucking their thumb or fingers, you might see them go back to that. We always talk about that even though infants are quite young, they can sense anxiety and sorrow. So if their caregivers are crying a lot or just like that tension in their body that a lot of us carry when we're very stressed, they can sense that. And they're very perceptive and connected to the people who care for them. And so it's just an important thing to remember as we care for infants who are grieving. Sometimes we'll see increased clinginess. So especially if you can imagine if they've had a loss of a parent or a sibling who is displaced, they may not want another person they love to leave because there's a fear of, will that person come back? And so it can be sometimes difficult to separate even, if that person goes to the bathroom or takes a quick run to the grocery store. Those things can be really stressful events for them. They can either sleep more, so sleeping all of the time, or they might also wake up more frequently, like they're having a difficult time getting good quality sleep. You might see them be more hyper and energetic. They're having difficulties regulating a lot of their energy. It's because their bodies are almost in that fight, flight, or freeze all the time, and so it's a lot of dysregulation. And then again, as we mentioned, they're going to be just most aware of any altered patterns of care. That's going to be the biggest thing that they notice with grief. So these are more simple strategies that we think about more broadly. Later on in the presentation, I'm going to talk more specifically about interventions for grief that we would say providers would use, but these are all good strategies for anyone in the community, parents, teachers, neighbors, coaches, anybody like that to think about if these are some strategies that could help support children at different stages. So for infants, the biggest thing, again, is schedule and routine. Because the biggest thing that they notice is their altered sense of routine, the more that we can provide some sets of routine or create a new routine for them that they can start to get familiar with, the better they will be able to cope with these changes. As we were talking about, because they can sense anxiety and sorrow and tension, thinking about when you're having those direct interactions with the infant, when you're talking to them and when you're holding them, making sure to the best of your ability. I know that it is often very difficult when the caregiver themselves is also grieving a loss, but being able to talk in a calm or soothing tone and having gentle touch, all of those things make a big difference because for a lot of our infants, comfort and soothing, those are the types of things that help get them in a place where they can relax. And then the other thing, this would be applied to all developmental stages, so I just included it here at the front end, but letting them know they'll be taken care of. That's a huge thing for infants of there can be that fear of, again, because of this altered pattern of care, what if something happens to this next person and who will take care of me? So just always reminding kids and all the way up to teenagers that you're going to be there. And again, letting them know who their support networks. Remember, you also have neighbor so-and-so and aunt this person so that they know that there's a lot of people who will love and support them. On to preschoolers. Preschoolers, I would say the most is happening at this age from a developmental standpoint that we have to think a little bit more creatively about when we're supporting them, just because of all of the developmental changes they're going through at this stage. So from a developmental perspective for preschoolers, they're gaining autonomy, right? So they're starting to be more independent. They're getting excited about being able to do some things for themselves, and they're exploring the world to figure that out, right? So they're trying to, they're very curious and figure out how things work. They're also starting to increase their language, so they're talking more, which is very helpful because that allows us to use conversation to support them. And then there's a lot of this magical thinking and wishing. They have huge imaginations, which is wonderful for a lot of things, but when it comes to death and dying, sometimes that can make it scarier for preschoolers. Their response in terms of those 4 factors that we talked about before, they still see death as reversible, so it's not something permanent to them. I can think of a situation where a preschooler at a funeral went up to a casket and said, when is grandpa gonna wake up, right? So again, they see it as just like this temporary phase. There's also this personification of death. So if you think about at this age, there are a lot of cartoons where a character dies, right? And then they wake back up, so they're seeing a lot of that. But they also might personify it through play. You might see whether it's with puppets or colors they're using or stories or things that they're telling. They're almost giving it characters or cartoons. And that's because they're still learning through exploring the world how to express themselves. And so they're doing it through play, which makes a lot of sense. And then there's this feelings of responsibility, which is one of the most important things when supporting a preschooler. And what I mean by that is if someone they love has died or they've experienced a big change, oftentimes they will think it's something that they did to cause it. I was a bad girl, or I didn't listen. That's why my dad went away. And so it's really important when we talk about recommendations that we're emphasizing to them that it was not their fault. This was a situation outside of their control. And when we talk about using language, I have a few examples later on, but especially for preschoolers, it is important that we're using death, dying. And I know those words often sound harsh, and sometimes it feels for a lot of us, it's softer to say passed away, but that's really confusing because it's not clear, and kids will read into that and think about different things. So we always say using the heavy words is what's most helpful in providing them like a clarification of what actually happened. Sometimes we might give a longer explanation, such as the body stopped working, like their heart stopped working, their lungs are no longer working, so they're no longer able to breathe. And again, that can sound very uncomfortable, but you're being very specific about what it means to die to help them understand the difference. Sometimes people might say things, as we mentioned, passed away, gone to sleep, taken to a better place. But as you can imagine for a preschooler, if you say gone to sleep, they may be worried to go to sleep because they worry if you go to sleep, you might die. So that can cause an additional issue. Taken to a better place, a child might say, well, I want to go to a better place. And then how do you respond in those situations? So again, trying to use as much direct language as possible is important. They're not going to understand the concept of forever, most likely, and sometimes that can be jarring for caregivers because they say, I keep telling them that. They don't seem to understand that daddy is not coming back, and that's just because developmentally, that's a really hard concept for them to follow, and so it's okay and it's normal if you have to keep explaining to them that daddy is not coming back, and helping them try to get to that place where they recognize it's a permanent change, but knowing until they reach the next developmental stage, that might not be a concept that they can truly grasp. And then, as we mentioned, they may believe they did something to cause the death. And especially in the situation in Ukraine, I think it's incredibly important that we tell these kids at this developmental stage that this was a situation totally outside of their control. It was not their fault. Nobody caused this. And letting them know that, again, that you're going to be there for them to help support them through this. And, you know, what we think about the result of this is when kids think they've caused the death, there can be a lot of guilt, and guilt can really exacerbate grief experiences. So it's important that from the moment we share with kids about some of these changes, we're really emphasizing at this stage that it's not their fault and there's nothing they did to cause this. These are some questions that you might hear preschoolers ask because, again, they don't really understand the concept of death and dying. So what does dead mean? Is it like going to sleep? Is he still hungry? Is he cold? Will he come back? Did I do something bad to cause the death? Did I think something that caused it? And who knows, there's a ton of other questions. That's the one thing that I've learned in working with kids is sometimes they ask things and I'm like, I don't know that answer. And that can be stressful for people who are trying to support them. But instead of trying to come up with an answer, it's okay to say, that's a good question. What do you think? One, because we don't have all the answers and none of us, really know what happens after we die, right? We all have different beliefs and values, but none of us have true confirmation of what that looks like. But when you give that question back to them, what do you think? You're allowing that space to open up the conversation of what's on their mind, and it kind of, not necessarily redirecting the conversation, but it gets to a space where you can talk about what made them ask that question and what's on their mind. So you can help support from that framework. But please do not stress if they ask you a question that you're like, I don't have the response to that. If there is a question that you feel like somebody could help support, maybe a religious or a spiritual member, like you could always say, that's a good question. I don't know the answer to that. Let's ask so-and-so. And so all of those things are totally okay. But please remember, you do not have to have all of the answers. And sometimes kids will just totally off guard ask you a question and you're not prepared for it. And it's okay to set boundaries about that as you support them. For preschoolers, we're going to start seeing a little bit more irritability. That tends to be how when we see a child is stressed, it's more of that irritability, like a little bit of a lower frustration tolerance. Similar to infants, they might regress to an earlier age. So you might see things again like thumb sucking, bedwetting. They might start talking like a baby. More fear of separation, clingy. At this age, you might start to see more fears and nightmares. And again, a lot of that is related to this fear of like going to sleep because they don't know if they're going to be there when they wake up, if the person they love is still going to be there. They may talk about death over and over at this age. Sometimes there can be a little bit of a fixation on it, and it can be at odd times. So like you might be doing something that is funny or there's lots of joking around, then all of a sudden they ask this like deep, dark question or make a remark about death that like catches you off guard a little bit. And all of that is normal because of where they are at their age, they're going to float through this a little bit. They don't stick with the hard stuff. So they're going to ask it and then they're going to go back to play. And that can be exhausting for adults a little bit, but recognizing that's normal. There's a lot of give and take when it comes to asking questions about death and dying. And they're still little. Their language is increasing, but it's very difficult for emotion identification. It's difficult for adults sometimes. So imagine preschoolers trying to identify something like grief that is very complex and has a lot of emotions. That can be really hard for them. And then sometimes when you tell them, I've heard from parents, they share this really heavy information about someone dying or this significant change that they experienced. And the child's like, and then they go play with their dolls, right? And that could be really concerning for parents because they say, I just shared this really heavy thing, but that's also normal. And it just speaks to that, the heaviness of that information or the context in which it's shared. Kids may not always understand the gravity, and that's okay. And usually what you'll see, again, you'll be dropping them off at school or you'll be doing something random and they'll ask a question out of nowhere that is directly relevant to that conversation. And they've just needed more time to process, and that's okay. Some ways to help. Being patient with this age is important because, again, they're going to repeat a lot of things. They're going to say things at off times. And I think that is the hardest part. They just throw us off guard at the situation because they're processing it at their own pace. Reassurance, so going back to that idea that there will be somebody who's going to take care of you and support you. Using straightforward words to talk about death and dying, as we mentioned, and being honest. So that's a huge thing that even though we recognize these are really hard conversations to have, and most caregivers don't ever imagine ever having to have some of these conversations with kids, if we don't tell them the truth and they find out at some point in their life that we did not give them an honest answer, it can make them lose trust in us. And our goal is to always be the people that they go to and be that support system. So even if it's really hard, it is always better to share the difficult information in a developmentally appropriate way. At this age, behaviors are normal regardless of what the child is going through. And so sometimes we'll get questions of, my child is going through so much. Should I be setting limits? I feel like I need to be more lenient because they're experiencing a lot of distress related to what's going on. And while that sounds, for a lot of us, that might be our intuition, what happens is for kids, they've already had all this significant loss, so there's no routine and everything looks different. And then all of a sudden they recognize the parents and their caregivers don't care when they hit brother or sister anymore, or when they say a bad word or they're disrespectful. And what that looks like for them is it's more red flags. They're like, okay, all of these changes have happened. Now people are responding to me differently. Nothing feels normal anymore. There is no routine. The world is very confusing and it's not making sense. And so that's how I always explain it to families, is by setting structure, giving limits, you are helping the child have some sense of predictability and normalcy of what life looked like before all of these changes happened. Maintaining routines, we've talked about that. And then modeling healthy grieving. As we mentioned before, many of you listening to this are also experiencing your own grief in relation to some of these losses and changes. And it is healthy to show that in front of kids. Obviously, there is, the intensity of that we want to be careful about, right? Because we don't want kids to be scared from our emotional expression. But when kids don't see the trusted adults in their life ever showing emotions, they may not think that those emotions are safe. And then they may kind of internalize those and not show them themselves. So it's okay to cry in front of your child. It's okay to tell your child that you're feeling sad or scared about what's going on. And it really helps them with emotional identification and expression. For school-age children, some of these go a little bit faster because they're developing more, they're learning more of those concepts. They have more concrete thinking. They're becoming more confident in who they are, increased socialization, so getting a little bit more interested in peers, and their thinking becomes more logical. And because of that, they start to understand more of those factors we were mentioning. Sometimes they'll see death as punishment because they're still kind of getting over some of those factors and trying to understand why people die, right? We're getting a little bit more of sense making why this happens. They want to see death as reversible, as we all would like that to be, but they do understand that it's permanent. So at about this stage, they're recognizing this is a permanent thing. It's not temporary. And they do recognize the universality, which is important because what that means is they may have more worries if everyone dies and they had so-and-so die, they may be worried about, when will my mom die? When will I die? And so it just brings up a different level of worry and concern. In terms of understanding death, again, they're in the process of understanding what death means. They're going to start asking those harder questions, such as why. So not quite to the point of teenagers that are more existential, but they are going to try understanding, why does this happen? They're going to wonder about the physical changes of what it means when somebody dies. Because again, if you've had no exposure to death and dying, a lot of kids don't understand what that truly means. So they're going to ask some more specific questions from that. And they may become fearful of going to sleep, of sickness, anything else that could lead to death. And again, I think in Ukraine, there's some more specifics about what caused the death of lots of people in this country. And that's I have a slide later on about explanations because we're describing a little bit different than somebody dying of cancer or getting in a car accident. And then as they're getting older and more logical and those critical thinking, their emotional identification vocabulary will expand. So they'll start to talk more about things like guilt and regret, things they wish they would have done, things they wish they would have said to their special person. And so they're just having a more complex emotional expression. And so it's important that we're supporting those different emotions. So we talked a little bit about preschoolers' questions, but for school-aged, again, they're going to get more into that sense-making. Why did they die? Will I die? That goes back to the universality. Will you die? And does it hurt to die? That goes back to the physical changes. That can be a concern when they're thinking about if everyone can die and I can die as well. I want to know, is it going to be painful? And what is that going to feel like? And oftentimes, we're telling kids that, most people go on to live a very long and healthy life, right? And I think grounding us in this situation, we hope that what's happening in Ukraine is not something that goes on forever and that, that their kids and future kids are going to have to experience this. None of us have a magic 8-ball and can predict that. But again, sometimes that reassurance can be helpful. Sometimes we are in seasons and unfortunate things happen to people and cohorts of people, but trying to help them ground themselves in that experience of what has happened. Common grief reaction for school age. So you might start to see more anxiety again because their worries and concerns are going to grow based on their understanding of death. You might see more crying. They might be in denial, guilt, withdrawal, anger. Because they're school age, they're in school, right? So dropping grades, difficulties focusing. You might see some regressions, but not as much of what you would have seen in the preschool years. More acting out, so some behavioral challenges, daydreaming. So again, that difficulty is paying attention. You might be talking to them and it feels like they're almost zoning out. Fear of their own death, death of another parent and guardian. We start to see more of those somatic symptoms. So they might start to say they're having more stomach aches or headaches. And then at around this age, you might start hearing things about suicidal ideation. And again, a lot of that can be tied to separation distress, in which it's a way that they want to feel connected with the person that they loved. But obviously very important to act on if they're expressing any of that. All of the ways to help, as I talked about, are all relevant as you keep going, but some of these are more specific for specific developmental stages. So at this age, because their emotional vocabulary is more expansive, we just want to make sure that we're validating the different emotions. So with grief, it's not as simple as just being sad and angry, right? They can have 15 different emotions all throughout the day, changing at all different types of moments, and all of that is normal and acceptable. There's not one way to grieve. And helping them give a chance to say how that person impacted them and what they have wanted to say. So creating those opportunities, just because we know guilt and regret is a newer emotion for some of these kids. And so trying to help work through them of what things were special about that person. What would you want to say if they're still here? What would you want them to know? And ways to help foster memories and help them feel connected, which again, we'll talk about a little bit more later. For our adolescents, so in development, they're formal operational problem solving, right? So they're really gaining these critical thinking, complex problem solving, abstract thinking. And so thus, when we think about their response, they're able to conceptualize death and understand all of those four responses that we talked about earlier on in this presentation. And because they have more of those complexities now, their spin and understanding is more related to existential identity, making meaning, those types of things. And they're going to try to make sense of the death that happened. So they typically have a full understanding of death because they're adolescents, and I imagine in these situations as too, especially if it was a caregiver or a parent who died or was displaced, they may have to take on more responsibilities, and that can be really hard. Sometimes kids and teens have to grow up faster than we would like them to, and we know that can sometimes complicate the way that they're coping with their grief. They may show a wide range of feelings or no emotion at all, which sometimes can be concerning, but again, recognizing within the adolescent stage that is normal and that might just be the way that they're expressing. So remembering that morning, what you're seeing on the outside, maybe it looks like little to no affect, but doesn't mean inside they're not experiencing different emotions, and giving adolescents the space to process that. They may act indifferent, so similar to that no emotion, but that is oftentimes a protective factor to them because it's too difficult to process. They may not be ready, and that's okay. We just keep monitoring and letting them know that we have a safe space to support them when they are ready to talk about it. And then because of that existential that they might start to think about, they may begin to question their own religious or spiritual beliefs as they're trying to make sense of what happened. Very similar grief reactions to what we talked about for school-age children. All of those are the same on the left, except we added risk-taking. So That's normal for adolescents on a normal developmental process and stage, but especially when you have these other stressors on top of you, they may start to engage in riskier behaviors, again, as a way to feel something, as a way to gain some sense of control, but just knowing that they're at a higher risk for that. They might have more changes in their sleep patterns. We know that peers are what's most important to adolescents, and so feeling different than peers, which again, I think this situation is in Ukraine is different because there's a lot of people who are experiencing this, so they may feel less alone than maybe some other specific circumstances where people have experienced loss or death. They're going to go talking a lot about that this is it's immoral, it's unfair, all of those bigger worldview things, because they're trying to make sense of a world that does not make any sense. You might see some more increase in conflict with friends and family because, again, they're trying to regulate. They're having a hard time with emotions, and you might just see more of those changes in social relationships, assuming more roles. And then, again, looking for that philosophical talk, spirituality, questioning. That tends to be a little bit where their language goes. Similar to school age, we're going to validate what those emotions look like. You're going to provide a space. With adolescents, the most important thing is letting them know that there is a space. We don't force them into talking or say, please tell me about how you're feeling. We more so want to offer them the opportunity. Remember, if there's anything you ever want to talk about, I'm a safe person. You can talk to me. Because, again, they may prefer to talk to their peers or they may need more space. And if they feel like people are constantly nagging on them, they may be less likely to go to you in other times. Create rituals of memory. So a lot of times when we're talking about fostering memories or routine, we're really trying to find ways in which they can cope and feel connected to that person. And so adolescents are pretty creative in what that looks like. It may be, celebrating their person's favorite holidays or making their favorite meals or making a playlist. There might be things that they do to feel connected that become a ritual. I know this is hard based on what families are going through, but we always have to think a little bit in the back of our mind for adolescents. Are we asking them to do too much in the wake of all of this distress, right? They're going through all this grief, and then we may be adding all of these additional responsibilities, which can be really stressful when they're being asked to grow up so fast. And I know that every family does the absolute best they can in managing, but it's something important to think about how it might impact their coping. Encouraging them to seek support from others. So again, if they're not talking to you as a parent, are there friends that they really trust, and encouraging them to have those conversations with the people that they're ready to talk to. And then having the adolescent feel like they can share what's most supportive instead of saying, these are the things that we know are helpful. What would you find most helpful? What can I do to be helpful? And knowing that's an evolving process. What you do in that first moment after that change, that loss, that death might look different 3 months from what that adolescent needs. And so making sure you're continuing to check in can be really helpful. So I included, this is very brief, but I just wanted to talk a little bit about sometimes when we talk about having this clear and open and honest communication, people say that's a great strategy. I don't know what it looks like in practice. And so I created 2 sample scripts of what it might look like for specific situations that have happened in Ukraine. If we were thinking about a preschooler to a school-age child, you might say something like, I need to tell you something very sad, honey. The war in Ukraine hurt a lot of people. So-and-so was in a place where there was fighting and their body was very badly hurt. The doctors couldn't make them better and they died. That means their bodies stopped working and we won't be able to see them anymore. It is okay to feel sad and to miss them. We all do. You can always talk to me about it. So the important factors here are, as we started off, we gave them a little bit of a warning that we were going to share something difficult. We gave the factual information of what happened in a developmentally appropriate way. We were very clear about what it means to die. And emphasizing when you do die that you don't see that person anymore, validating their emotions, and then ending with reassurance that somebody is always going to be there for them. If you were talking to an adolescent, you might say, the war has taken many lives, including so-and-so. They were killed in the fighting. It is normal to feel angry, numb, or heartbroken. You don't need to go through this alone. We will face it together, and we can talk whenever you need. So a similar structure, a little bit higher level because of their ability to understand that. And when you think about that reassurance or offering the support, it's more so putting it in the adolescent's court of whatever you need, I'm here to do that, which I think is really helpful for adolescents to feel like they have a sense of control and what is best for supporting them. All right, and then our final section here is to talk about some evidence-based assessments and interventions. So some of these strategies might be things that parents and other caregivers can apply at home, but there will also be some specific information relative to if somebody is experiencing grief that is significantly impacting functioning, interventions that would be helpful for them to help cope with their grief and the adjustment to loss. So when we think about what are signs of adaptive adjustment to grief, one is if the child talks openly or asks questions. So that tends to be more of a protective factor if they're able to engage in conversations about the loss, ask questions, what it means, and really just be engaged in that conversation. They feel comfortable expressing their thoughts, sharing emotions of what is developmentally appropriate based on their understanding and their feelings related to death. Similar to what we're talking about with the dual process model of grief, they're able to go to both positive and negative events and feelings. There's a little bit of a balance. It's not like they sit in just one land of all positive things or all negative things, and they're focused and processing the loss. They create some opportunities for that, but they can also talk about rebuilding life after loss. They're able to talk about the deceased, so if people are sharing stories or they're able to share memories, that tends to be more protective and adaptive. And they're able to move forward in a healthy developmental trajectory. So they're still able to do what is possible, if that's going to school, hanging out with friends, getting out of bed in the morning, their activities of daily living. And so adaptive, that's the biggest piece for me when we think about what is adaptive grieving. If the grief is significantly impacting their functioning, that's when we tend to have more concerns. I do always like to say a caveat that this is a very westernized view of what we think about when we think about adaptive coping with grief. And we know that some cultures and spirituality and religions can impact what that looks like in terms of mourning, what it looks like on the external. And so it is always important when we're meeting families or we're thinking about the support to truly understand their value systems, because there might be something different in the way their system runs of what's important to them culturally or spiritually, where this looks a little bit different. These situations are a little hard. Sometimes when you're thinking about somebody who has an illness and you have a psychosocial provider following, you get to know that family earlier and kind of know how their system works so you can best support them when they're grieving. But when it's things like trauma and unexpected, we don't always get the opportunity to know those families at baseline. And so you might have to back up a little bit and ask some of those questions to really understand their family system. So prolonged grief, as I mentioned, we were going to talk about listing the diagnostic criteria. The definition of prolonged grief is it's a persistent yearning, a preoccupation with the deceased, and intense emotional pain that causes significant functional impairment. And again, that's the most important piece, that it's impairing their ability to function day to day. There's two different timelines. So for children, it's 6 months, and then for adults, it's 1 year. This diagnosis was recently added to the revised version of the DSM, which is the diagnostic manual that psychosocial clinicians use to diagnose. And there is some controversy around that. People have different feelings about whether prolonged grief is a diagnosis. And when they created this diagnosis in the manual, they expected it to apply to around 4% of bereaved people. Here are the symptoms that are listed in the diagnostic manual. So it's a longing or yearning for the person who died. It's intense feelings of emotional pain, sorrow, or pangs of grief. Avoid the reminders that the person who died is gone. You might feel stunned, shocked, dazed by loss, confused about your role, don't know who you are, more of an identity. Troubles accepting the loss, feeling bitter. You believe moving on would be difficult, if not nearly impossible. You're emotionally numb, and you feel that life is unfulfilling, empty, or meaningless. So when we think about these, the reason why I wanted to put the slides is to help people understand, and I'm going to show a chart that will be a pyramid that kind of talks about the levels of interventions and how we kind of triage those supports. But I wanted people to understand a little bit about, at this level, when a child is experiencing prolonged grief, or a combination of some of these symptoms and a significant impact on their functioning, those are the children that most need evidence-based support from therapists. They need more than maybe what their community can provide them. Some kids who are grieving can receive support from their community and be okay. There's things that we can do. But if kids are showing and demonstrating these types of symptoms and they're not functioning as they typically would day to day, then that's when we need to intervene more with evidence-based assessment and intervention. So these are just a few examples of assessments of what I tend to use in my practice. There's the prolonged grief disorder checklist, and a few of these I have some pictures coming up. There's a grief facilitation inventory, intrusive grief thought scale, short mood and feelings questionnaire, and then if it's grief that is traumatic, you might use something like the PTSD UCLA questionnaire. So this is the prolonged grief disorder checklist, and you can see there's 6 items here, and those are, if you remember, if we went back to the multidimensional grief theory, those questions are targeting those domains, so that existential identity, separation, and circumstance related to distress. And for this one right here, if you sum all the scores together, scores of 9 or higher indicate a higher risk for PGD. And then you can see there's another picture of like showing 5 pictures of cups that show different answer choices. And for each question, point to the cup that shows how true that sentence is for you. So shows you a little bit from developmentally. It's something that kids can see because they tend to do better answering these questions when there is some visual. So this can be it's nice because it's quick and it's short, but it can help you kind of know which domains of distress that kids are experiencing, but also knowing their risk of prolonged grief and helping them triage sort of what supports would be most helpful for them. This is the caregiver facilitation inventory, and I really like this one for more so using, as you can see, and I apologize, some of these pictures may not be as clear as I hoped they were, but it talks about different behaviors or responses that caregivers can have. And a lot of times when we're talking about these evidence-based interventions, we're trying to identify within the home what caregivers or other trusted adults in their community can do to help them. And so this measure goes through different things, and some of them are adaptive and some of them might be more maladaptive, but thinking about every kid is different and they might find different behaviors helpful for them. And so it really helps facilitate that conversation between the caregiver and child, that for a grieving child, doing X, Y, and Z is what helps me feel most supported by you. When you're first meeting a child, I think, we talked about some of those are evidence-based assessment, but then there's also like that intake, right? And there's open-ended questions that we're asking and really trying to get to know the child, recognizing that these are really hard concepts and things for the child to talk about. So we want to, make sure that we're integrating rapport building and things that help them feel comfortable, because these are not going to be easy topics for a lot of kids to disclose, especially if you're a new face to them. So in relation to the nature of death, it's important to know, what does the child know? Did they witness the death? Those are crucial questions in terms of shaping what types of interventions would be most helpful for them, right? If they witnessed the death and it was traumatic, they might benefit from a different type of intervention and what they know, right? We would never want to disclose more information, and we want to make sure that we're giving them that honest and open information that's developmentally appropriate. As we were talking about before, we need to understand families and family systems. So what does that child believe happens after death? It's hard to support a child if we don't know what their internal beliefs and values are. Ongoing stressors. So again, there's more to these kids than just what happened with these losses and stressors. So how has their routine changed? How is their primary caregiver responding, right? Kids do not operate in a silo, they're operating in systems. So especially in this situation, you have parents who are grieving, you have caregivers who are grieving, siblings who are grieving, they have friends who are grieving, and teachers who are grieving, right? Like it's a domino effect with what's going on in Ukraine, and that's important for us to understand, that they're living in a system where lots of their supports and people around them are also grieving. And then coping strategies. Thinking about what has helped them with stressors before, what has communication been like, who can you talk to, and who are your supports? And this just helps us get a better understanding of some of those basic things to help shape the intervention. This was the chart that I was talking about before, which is the psychosocial preventative health model. And this isn't specifically used for grief. It was actually used more in relation to trauma and other medical stressors, but it's very much still applied. And you can see that there's 3 levels here. So universal would be supports that would apply to any child who's grieving. So any child would benefit from that. And that might be something like communication, right? Every child deserves to know about the loss and to understand what happened. Then you might have more targeted. You're monitoring distress and risk and factors, and you're providing interventions, but they're targeted, right? They're specific. Maybe it's 2 times you go to this thing, or it's like a very short-lived thing that you do. Sometimes that might be like a grief workshop, or a little like a webinar that parents watch to help support their child. And then that top part of it, the orange, is clinical and treatment. And those are the kids that I was talking about who meet the criteria for prolonged grief. They're going to benefit from working with a behavioral health specialist who feels comfortable addressing these types of issues, whether that's trauma and or grief, because of the significant impact to their functioning. So in all of these, therapies, and when we're talking about the universal interventions, all kids benefit from psychoeducation about grief. Sometimes, kids have never even heard what that word means, right? So when you say saying that they're a child who's grieving, they don't know what that means. So it's important to talk about what grief is and give them some context. These are a few things that I often think about when I'm explaining grief. And when we think about grief as a journey, right, it's not something that you don't ever heal. Kind of when we're thinking about the Elizabeth Kubler-Ross, you don't get in the stage of acceptance and just move on. It's a part, and it ebbs and flows. It's like an ocean, right? Sometimes those waves hit you, and other times, the waves, everything is very clear. And so we talk a lot about grief triggers and bursts, and it's important before you start treatment to help kids understand that this is not a linear process where you get to it and you're like, oh, I can dust my hands off, I'm good. You're going to have moments where it is a little bit of like a roller coaster, and that's normal. We talk about grief cannot be fixed, it can only be carried, and that's something that I think is important for any adult in the child's life, because when we see kids who are hurting, we want to fix it. And unfortunately, grief is something that we can't fix. It's not a problem that can be solved. And so it's important as a parent, as a psychosocial clinician, that we think about it in the sense that you're there to provide a supportive presence, you're there to listen, you're there to validate, to give them some coping strategies, but you're helping kids carry this, knowing this is an experience that they will carry with them for the rest of their life. A lot of kids will talk about feeling guilty if they do fun things, if they laugh again, if they smile again. And so letting kids know that even though grief is a difficult experience and they're going to have a lot of emotions, it's okay to experience positivity again. You can laugh, you can smile, you can have fun, and you can still be sad and angry and frustrated. There's room for both. And there's no right way to grieve. That should have been the first one that I included there because it's the most important thing. Everyone in their network is going to grieve differently. There's not a right way to do it, and it's okay, whatever their way looks. We're just trying to figure out what is the best way we can support each child. The other thing that comes with psychoeducation is clarifying misconceptions. There are so many grief myths out there that kids have heard over time, and it's something that they think about themselves, and then they judge their own grieving or the grief journeys of others around them. So one, all losses are the same. They're not the same, right? They're very different, and what's happening in Ukraine is very different than a lot of the grief experiences that we talk about, kids in other countries and other situations. Grief has a timeline. Like I said, it's an ongoing thing that kids will deal with for the rest of their life. And our goal is that we hope we give them better coping strategies over time to help make it less impairing. But there's not a clean timeline of how this works. Everyone grieves in the same way. We've already talked about that. Grief steadily declines over time. When grief is resolved, it never comes up again. So all of these are related to that there is no timeline. It ebbs and flows. It's better not to think about your pain. That goes back to the dual process model of grief, right? Avoiding and only doing restoration-oriented changes is usually not the most adaptive way. There's no reason to be angry at your deceased loved one. That's important. A lot of times kids will feel guilty if they feel upset with like, I was just mad at dad yesterday and now he's no longer here. That's okay. And it's okay to say that you didn't love everything about dad, right? There might be some things that frustrated you, and that's okay. Children need to be protected from grief and death. So again, if we don't talk about the big things, it becomes the elephant in the room and it becomes much scarier. So it's important that we talk about these scary and heavy things, because the more we talk about it, the less scary it becomes. And you will have no relationship with your loved one after the death, which again is untrue. And we really want to facilitate ways that they can still feel connected to their loved one, which is the continuing bonds. This is a little picture that I like to show sometimes to talk about, like with grief psychoeducation. So you can see on the top, it says, people tend to believe that grief shrinks over time. You see the ball getting smaller in the jar. But what really happens is that we grow around our grief. So the ball stays the same size. That grief experience is always with them. But as you think that restoration oriented, their purpose, their identity, all of that shifts, and the jar gets bigger over time. So again, for kids, it can be helpful to show visuals when you're trying to talk about these really abstract concepts. Emotion identification, this is also a universal intervention. So for anyone out there supporting a child who's grieving, it's important that we talk about different feelings, recognizing that grief is just a combination of so many feelings. Classic ones that we tend to hear with grief is anger, guilt, anxiety, worries, feeling helpless, and sadness. So I've talked a little bit about, some of those questions to really facilitate conversations about those emotions. So anger, how did they disappoint you? What was unfair about their death? Guilt, what did you do? What would you have done differently? Anxiety about death, wishing they could have helped save the person, and then sadness, highlighting what's been lost through death and the different experiences that they've had in relation to the loss. These are some more visuals. So again, sometimes I've actually had yarn that's all tangled up similar to this, and recognizing the one that's like rainbow colored, and they're all different, but all to say it's a lot of emotions intermixed, and all of that's normal. And then the outline of the body, I usually put that because, again, I think a lot of times when kids think about grief, they only think about like emotions and like in their brain, that's what they associate that with. But grief is also very physiological, right? And we feel emotions throughout our body. And so you can do different activities of having them choose colors for certain emotions and where they feel it. Sometimes they might feel it around their heart. Their heart is heavy or hurt, or it's difficult to breathe, or they have a tension in their arms or legs, or they're getting stomach aches and belly aches. But it can be a nice visual to show how grief is affecting them physically as well. We were talking about the theory continuing bonds before, and so again, this is an intervention that is also universal, anybody can do, and this is the most important thing you can do in any interaction you have with anyone who's grieving, because what we often hear from anybody who's grieving any type of change or person, they're worried that that thing or person will be forgotten, and so we're trying to find ways to help them still feel connected with the person that they loved. So it can be as simple as starting a conversation of, what do you miss most about Dad? What's a favorite memory you have with your sibling? They can share stories and videos and scrapbooks. You might carry a picture of them in your pocket. You might have it on your nightstand. You might wear the necklace, your mom's favorite necklace. You might celebrate their birthdays or make a playlist of their favorite songs, go to their favorite place, the park, create a card deck with questions so that at the dinner table you're regularly asking questions and talking about the person. So ways that you can just integrate, again, they're not physically present here, but how do you still keep their spirit alive and help kids know that they're still a part of them and they can live through them? And then before we jump into some more specific grief interventions, I always want to say, when we think about grief, there's a lot of overlap with other conditions that we treat as psychosocial providers. So when we think about depression, for example, we talk a lot about parenting styles, so communication and warmth, all of those things are relevant for kids who are grieving. There's a lot of sadness and grief, just like there's a lot of sadness and depression. So those interventions are still relevant. Behavioral activation, right? So trying to identify activities that they enjoy, activities that keep them physically active, activities that help them feel connected with others, those that make them feel accomplished. All of those things can be important for both depression and grief. You could apply them to both. PTSD, we'll talk about that for CBT for childhood traumatic grief. Anxiety, some kids, like I said, will be scared to go to sleep because they think that when you sleep, you might not wake up. So you might do things like exposure hierarchies in relation to helping them feel more comfortable with sleep. You might do some thought challenging related to death and dying. You might do some relaxation training, right? As we said, that you can feel grief very much physically. So teaching them things like breathing and guided imagery and those types of things. And then behavior, we talked about with preschoolers, it's important that you're still setting limits to give them some normalcy and expectations. And so behavioral management strategies still apply for kids who are grieving. You talk about positive parenting, maintaining structure and routine, and other types of strategies like that. So all that to say, what you all have in your toolbox as psychosocial providers, a lot of those interventions are still relevant and can be applied for kids who are grieving. And then grief-specific interventions, just a little bit of background on interventions. A lot of the evidence-based interventions that were initially created for grief had a trauma focus, and that is very much relevant to the situation that we're talking about today, and we're going to go through a little bit of those. But there have been less therapies that also provide supports for kids who have not experienced a traumatic death, and we'll get to the one that does have two different phases. So most of these, like I said, and again, this is relevant to what we're talking about today, are therapies that are targeting both trauma and grief. So you have trauma-focused CBT, you have trauma and grief component therapy, which is similar, but it's more specific for adolescents. Multidimensional grief therapy is shaped off the theory that I was talking about earlier in the presentation, and that is the one that has two phases. So the first phase is relevant for any child with any type of grief. So it's not just specific to experiencing a traumatic death. And then the second phase is more trauma focused. And so if they did not have a death that was associated with trauma, you would just do phase one. The family bereavement program is another intervention that talks about grief, and this one is really focused on shaping like caregiver parenting and communication, which is really helpful because that's a large part of grief. And then there's meaning-centered therapy. So we're going to touch on a few of these, and I have a little bit of some case examples to talk about what it might look like to use some of these interventions. So we're first going to start with trauma-focused cognitive behavioral therapy, and these are the different phases in which you run through. So generally, like short-term might be 12 to 20 sessions, depending on how much you're able to move through some of these. But I'm going to go more into some specifics using a little bit of a case example to just give you a little bit of a highlight of what that might look like. So this is another breakdown. It's a table here, right? So where you have the module, the goals of each session, and then more of like what that grief-specific adaptation is. And I wanted to use a little bit of a case example to talk about what this might look like if you were treating a child with this approach. So we have Anya here. She's a 10-year-old girl. She lost her father in a missile strike during the early days of the war, and she and her mother relocated to a safer region in Western Ukraine. She started exhibiting signs of acute grief, so again, relation to this event that just happened unexpectedly, and this looked like nightmares, hypervigilance, and withdrawal from peers. So she was no longer engaging with people as she used to. So if we start here and run through this model, the first one is related to psychoeducation and parenting skills. And so what we talked about, I gave some psychoeducation before. We're trying to help kids understand what the grief process looks like. But if they've had trauma as well, again, there's some overlap between grief and trauma, but there are some specific things that make both of those constructs unique. So we're talking about trauma and also integrated grief, which is more of some of those positive experiences and different ways that you come through it with loss. And so we're talking about, giving them education, but also normalizing their reactions as we learn what Anya is experiencing. And so sometimes we might talk about things like, Anya says, I am sad and I'm angry and I'm confused, and we're validating that's common. That's what we see when people have experienced grief and trauma together. We might use some metaphors to say, like, when a child experienced something like a trauma, that's like a computer that needs to reboot after a traumatic experience. And that's what we're going to do in all of these modules, is we're trying to give you strategies to give your brain that opportunity to reboot from this very difficult experience. And so this really is setting the tone to help them understand these are the concepts we're going to work on, but also validating the experience and the symptoms that they're having. The second module is related to relaxation. So this is something that a lot of us are familiar with. Remember, we said when we had the outline of the body that grief can be very physiological and physical, and so can trauma. And oftentimes these kids are in the fight, flight, or freeze, right? So their body is hypervigilant, they're always on guard. And so we're teaching them things like deep breathing, mindfulness, guided imagery, anything to really help get that nervous system in more of what we call the rest and digest, or the relaxation system, the parasympathetic nervous system. And that's going to help with things like with Anya having nightmares, right? When she's going to bed, she's so hypervigilant and her body is tense and stressed. And so being able to give her some strategies that she can practice before bed to get her body more relaxed might help alleviate the frequency of those nightmares. The next one is effective expression and regulation. And so this is kind of what we were talking again about, this helping them identify emotions and regulation. So for example, for someone like Anya, we might have her create a feelings journal, right? Where she draws different faces and expresses different emotions. And then when she comes to sessions, she can share that feelings journal with her therapist and talk about, like, what was happening when you felt sad? Like, what made you feel sad? Maybe she saw something that reminded her of her dad, and really being able to facilitate discussions. And okay, so it sounds like you were sad on Tuesday because you saw this. What are some things that you could do? And that might be practicing some of those relaxation strategies, talking to her mom, finding other positive supports. And then the fourth one is the cognitive coping. So this is really trying to address and reframe unhelpful thoughts. So as we talked about again, for someone like a preschooler who thinks that they did something to cause the death, we may want to be able to help gently challenge that to help them understand that it was not their fault. And so in this situation, Anya believes that she could have prevented her father's death, or there was something that she could do. And so the therapist would really work to help her understand that these events were beyond her control and that she was not to blame. And a lot of that, especially in these situations, I always say it's like gentle reframing. We have to be very careful because some of these are really hard beliefs for our kids. And so we have to be very careful when we're trying to do some gentle thought challenging for them. And then there's 4 more modules when we're talking about TFCBT. So the next one here is related to trauma narrative and processing. So this is, we've talked about the missile strike in which her father died. So we're trying to give her the opportunity to process this traumatic event in an environment that feels safe. And so sometimes for kids, it might look like, in terms of writing that trauma or grief narrative, like writing a letter to her father, and she might share how much she loved him, and it's a way for her to say goodbye, because this was something unexpected that she was not able to prepare for. And then in those sessions, as they write, then they're able to read. And again, you're processing the emotions, having her practice those relaxation skills and other coping strategies, because again, we're exposing her to that traumatic event, but in a safe space, and allowing her to learn coping strategies with it. The 6th module is in vivo mastery of those trauma reminders. So gradually helping expose Anya to reminders of her father to reduce avoidance. So oftentimes when kids experience trauma in relation, and then we add grief in as well, they may avoid things that remind them of that special person. So they may not eat the foods that their father loved, or go to the places that he loved. So Anya's father really liked to go to a local park, and it was really difficult for her to even go past the park because it reminded her so much of her father. And so kind of thinking from an exposure of getting her to a place up to that point where you can actually take her to the park, right, and have that opportunity for her to feel closer with her father. And that goes back to what we were saying with continuing bonds. If we can get kids there, it helps them feel safe and connected. But that is a process for kids who've experienced it in a traumatic way, because it can remind them of that traumatic event. And we want her to create positive associations with these places, but it certainly takes time. And then for 7, it's more conjoint parent-child sessions. So up until then, you might be doing a lot of these things independently with a child, but because grief is a universal experience and one where we're trying to help get her within her community and her systems of supports, we want mom to be able to practice some of these strategies and to work on some of those communication techniques that we know can be very helpful for Anya. So we might talk about things like active listening and supportive communication. And that goes along with, again, for grief. A lot of parents want to jump in and be able to fix because it's so hard to see their child struggling, but reminding them that what kids really need is someone who is active listening and validates and is not trying to always give them like, I'm going to fix this problem, but hearing them. That's really hard, honey. This is very difficult. It's okay to feel sad and worried. I'm going to be here for you. And so changing the way that they communicate in that way. And then the last one is enhancing safety and future development. So that's almost like you're creating a coping plan in the future. The goal is not to be in therapy forever, right? When we're talking about providing a therapy for a child, we're trying to give them a whole bunch of tools, and then we can go have them integrate into the world and be able to apply those skills. And so you create a coping plan for the future. If certain triggers were to arise or certain situations, how would those be addressed? And being able to talk through those with both Anya and her mother so they feel best prepared. So that's trauma-focused cognitive behavioral therapy. That slide I had that had a lot of grief-specific interventions, there is a lot of overlap. And so again, there might be different components that are worded a little bit differently, or they're worded differently based on the model that they're around, but they're very similar concepts of what they're doing. So this therapy right here, like I said, originates from the model that we were talking about, the multidimensional grief theory. And this was the one that I said had 2 phases. So phase 1 would be relevant to any child who's grieving. And again, it's assessment, it's psychoeducation, it's talking about regulating emotions and grounding techniques and developing rapport and establishing safety. Phase 2 is for those kids who have experienced trauma. So going back through those domains of separation distress, existential distress, circumstance-related distress, and you'll see the interventions that fall under each of those domains are very similar to what we just talked about with TFCBT specific to grief. And I've included some, this is like in their website, they actually have it's a book with Caplo 2023 that you can buy. And on her website, she has some of these pictures available. So these are just some examples of if you have that book or you're able to capture like the online version to have some of the materials to use. So on this left-hand side, it's like a grief thermometer. And it talks a little bit about specific things that a child might be feeling. And then they're rating it. Because again, for our younger kids, we're trying to give them more visuals to rate their experience. The second one is related to goals. So that would be a good one up front to help kids kind of set what certain goals or things that they want to work on from a grief perspective throughout therapy. These are 2 other activities. So this first one is learning about different like grief reactions, talking a little bit about every kid responds differently. So they have all of these clouds or bubbles, and kids will identify which one of those resonates with them. The other one is it's a list of like loss and trauma reminders, right? So you can see so-and-so's belongings, pictures or videos of them, activities we used to do together. And as we were talking about with Anya, some of those things might be more difficult for kids because it reminds them of that trauma and the loss. And when we can identify what those things are that are difficult for them, then it allows us in that exposure hierarchy to be able to help get them to a place to recreate positive associations with things that help them feel connected with the person that they loved. They also have, similar to as we talked about the trauma narrative, they call it the loss narrative. And what you'll see is I have these different chapters of the narrative in different colors. So blue is for the separation distress domain, pink is for the circumstance-related distress, and purple is for the existential identity-related distress. And each of those chapters are addressing those domains. And so I created a little bit of a story here of what this might look like if a child were to write their loss narrative. So this is Ivan. So my name is Ivan. I am 8 years old. I like drawing and playing outside and listening to music. I love my friends, my home, and the small things that make me happy. I try to be brave even when things feel sad or scary. Chapter 2, Mama and Dad always made me laugh. I remember the time we cooked together and I accidentally spilled flour everywhere. They just laughed and helped me clean it up. We used to play in the park every Sunday. Sometimes we would sit and talk about silly things, and I felt like the happiest kid in the world. I remember bedtime stories, hugs, and the way that Mama and Daddy always believed in me. How they died. One day they had to leave because of the war. It was sudden and scary. I didn't understand everything at first. I was confused and sad, and sometimes I felt angry. I know now that it was not my fault. They loved me, and nothing I did or didn't do changed that. How I can stay connected. Even though they're gone, I feel them. I talk to them in my head. I keep pictures and letters that remind me of them. I draw pictures for them, and sometimes I whisper to them what happened. When I do something they loved, I feel close to them. Where are they now? I like to imagine them watching over me. Sometimes I feel them in the wind or when I hear a song that we liked. I don't see them, but I do feel them and what they taught me. How things have changed. Things feel different now. I have more to do, and sometimes I am lonely. I miss having them there to help me or tell me what would be okay. I get sad, and it's hard when friends or teachers don't understand why I'm sad, but I'm trying to be strong and take care of me. Carrying on their legacy, they taught me to be kind and brave and to care for others. I try to do those things every day. I help my friends when they're sad, and I speak up when someone needs me. That makes me feel like I'm with them and they are here. Making meaning. I have learned that sometimes life isn't fair, and sometimes people we love leave us too soon, but I learned that their love doesn't end. They still love me, and it reminds me to be kind and brave like them. I try to find special ways to honor them when I'm scared or sad. And then looking toward the future, I hope to grow up strong even though I miss them. I want to make good choices and help others like they would want me to. I know I can still be happy even if my heart feels sad. I will always carry them with me in my heart. So it's just like a little bit of an example of a situation of what that would look like. And again, it's not you go in one session and write all of these, but you're trying to work through those different domains of distress and help them feel connected to develop adaptive strategies relevant to that. And then just a few more things here before we wrap up. So I did also mention meaning making. So meaning making is a very broad, I have an umbrella here because I think of it as an umbrella construct. And we've actually talked about a lot of these within different therapies and other slides. So within the umbrella construct of meaning making, you have sense making, which is understanding why the death happened. You have purpose and identity reconstruction. So again, trying to understand who am I now that I've experienced this loss. You have benefit finding, which was similar to post-traumatic growth a little bit, again, of finding when you're faced with adversity, how you're growing, and then continuing bonds in the way that you continue to connect with that person. So meaning making is more of an intervention we think about. These are the open-ended questions that we're asking kids and teenagers. And I just gave some examples of questions within those domains that you could ask, but all of this is conversation-based, and it's just a way to help kids explore. Little kids can do meaning making. Obviously, it'd be at a more developmentally, appropriate pace. I would say this is most relevant probably for our older school-aged or adolescents because of that existential identity that they're really trying to process when they experience loss or change. But you can see in the sense making, what do you think it means when someone dies? Has this changed the way you think about death or the way you think about life? Continuing bonds, we've talked a lot about that. Identity and legacy, what is something that they taught you or that you believed in that you want to carry forward? What parts of them do you see in yourself? So helping them, again, integrate with this identity and the legacy that they carry on. And then coping, growth, and hope. So what helps you on your harder days? Who helps you feel supported? And these are, again, just different ways that you can ask that. And obviously, again, we're thinking about developmentally. So for younger children, I might say, if you could draw a picture of so-and-so, what would they be doing? Or if you could send them in a message in a balloon, what would you say? When you think of them, what color or shape comes to mind? So it's not as specific to that, but it's maybe using like drawing, coloring, and play to help them explain a little bit about this. And then obviously for teenagers and young adults, we can use a little bit more deeper questions to help them practice meaning making. And then lastly, it's important to talk about, again, as we said, kids live in school. So it's important that we're also connecting with that system because they're going to get a lot of time with kids. And I apologize, this font is a little bit small. These are just 8 strategies that I would think about when we're supporting grieving kids in school, what we should be thinking about. So one is asking students what they would like shared with their teachers and classmates. So that can be really stressful to return to school and not know like what is being said about them, what people know. We want to give kids control of their narrative. I know that's not always possible, especially when it's happening all around you all, but we want to give kids the ownership to share their story. We talk a lot about like a difficult day safety plan. So, here in the United States, we have things like 504 plans and individualized education plans to help support kids. We've talked about what it means to have like a bereavement support plan, and it may not be something that carries with a kid throughout the rest of their schooling, but it's something to really identify what supports are helpful. So let's say it's, there's a conversation related to their curriculum where they're talking about fathers and that person doesn't have a father. That could be a significant trigger for that child. And so making sure we have a plan, or if the child is just sitting in the classroom and all of a sudden gets this overwhelming sense of grief, can they just put like a sign that they have like on the teacher's desk and be able to walk out and go talk to a counselor or another trusted adult. But we want the kid to feel like when they're in school that there's things that they can do to help support themselves. lots of communication between the trusted adults, caregivers, and teachers and loved ones to make sure how they're doing in both settings. Sometimes we'll see more things at school because they don't feel like it's safe to display at home because they know that their parents are struggling. And so it's important that we know what's happening in both settings. Drop-off and pickup routines can be really difficult for kids who are grieving, and especially for those younger developmental stages, because again, if somebody that they loved was displaced or killed unexpectedly, they may worry that another person that's supposed to pick them up or who loves them won't pick them up, or they won't come back. And so if you're usually there at 3:30 and all of a sudden it's 3:40 and they're not there, they might start to spiral with their worries. And so it's important that we have plans for what that looks like. Discussing after school rituals. So after school, right, helping them, again, this is all about creating a routine for our kids. And then recognizing that a lot of our grieving children are going to have difficulties with concentration, memory, retention. And so you just want to keep our eye on that. It's not that they don't understand or that they have a learning challenge. Grief can definitely impact cognitive functioning. And so we need to keep that in the back of our mind when we're conceptualizing how a child is performing and trying to find that balance of giving them grace for what's going on while still helping support them to meet their academic goals. And then making time for recreation, play, and friends, and helping them feel connected. Obviously, that's important from a support perspective. And then helping them anticipate changes in their friends' behaviors. All across this world, we are grief phobic and we don't always know how to talk about grief. And so what happens is when we're uncomfortable, we don't say anything, and it makes kids and adults feel like the people in their life don't care about them. And so it's really important that even as like teachers and principals and school staff, and if we can help the kids in that school feel comfortable enough to say something to somebody about their dad, to ask those questions, to say, I'm here if you need me. And that's why we want the kid to let us know what's helpful. Do they want people to ask them about their dad, or would they rather school feel very normal and not talk about that? Do they want people to do something kind for them when they're feeling sad, or would they rather just talk to the teacher, right? We need to figure out what's helpful for them, but we need to also help give kids words of like what it means to express condolences and be supportive to their peers so that their kids don't feel like no one understands. And again, it's usually not that they don't care, it's just that they don't know what to say. And so we choose to be silent in those situations. I've included a list of some of my favorite websites, and they're, it's a long range here, but all of these I think have great resources. A lot of them have handouts that you can print and are organized in developmental stages. I would say the ones I'd want to highlight is the nacg.org and the Dougie.org. They have a ton of websites or a ton of resources that I always use. And again, they're very handy and we don't have to reinvent the wheel. So those could be useful things to look at in terms of shaping supports for our children. And then this is a list of references that I use to guide the presentation that I have today. And thank you all for letting me share this with you.